So what is gene therapy? Broadly speaking, this is using viruses as medicines. So historically, we have used these to treat single gene genetic disorders, but we can use these much more broadly now, and I'll share a little bit about that. But historically, we've used these when you were born either missing a gene in your genome or you had a mutation in a particular gene in your genome. And all you needed in order to be completely healthy was to have a functional copy of that gene given back to you, or to have the particular mutation in that gene corrected and restored for you. And we can do all of these with viruses. And so if that sounds a little bit crazy and a little bit new and a little bit revolutionary, it's because it is. We're kind of quite literally living through one of the most recent and kind of newest eras of modern medicine. And so in order to talk about where we are, we kind of need to understand where we came from. So nearly every one of you in this room, this first era of modern medicine started probably with either your parents or your grandparents. This was with chemical medicines. This is when we realized that, gosh, every time I have a stomach ache, I can go eat this one particular leaf from a tree, and when I eat that leaf, I feel much better. And then the scientists realized, well, we don't have to eat the leaf. We could isolate the chemical compound that comes from that leaf, and then we could produce that en masse synthetically in large vats in the lab, and that way we don't have to all go outside and eat leaves all the time. And so the advent of chemical medicines and realizing that we could isolate these and synthesize these en masse was an absolute transformation. This is nearly every drug you've ever taken in your life. These are all the pills you can go find at your local pharmacy, particularly the ones that are over the counter. And so this is the vast majority of medicines you've ever taken in your entire life. And the way these chemical medicines work, right, you take that pill, you swallow it, it goes into your stomach, it gets dissolved by the acids in your stomach, it then gets absorbed into the bloodstream in your GI tract and then goes throughout your entire body, and it will bind to and affect kind of either the shape or the function or the ability of various proteins in your body in a way that's useful to reduce your symptoms. And so then in the next kind of era of medicine, we had the brilliant idea, well, let's just cut out the middleman. Let's not give you a chemical that alters the shape or function of a protein. Let's just give you the protein. Let's advance to protein medicines. And let's now take a protein that has the particular shape and the function that you might need in order to provide some kind of therapeutic benefit for the disease state that you have, and give you that as a drug. And so that's kind of been the next kind of most recent wave of modern medicine. And so this is things like enzyme treatments and antibody therapies. Many of you in the room have probably heard of the most successful drug of all time. Anyone know what it is? Anyone want to shout out a guess? What's the most successful drug of all time that's raised the most money? It's not Viagra, guys. Humira, someone said it. So this is an antibody that's used to treat a particular form of arthritis. This antibody sells, on average, a little over $21 billion worth of just that drug every single year and has been the most successful drug for the last 20 years. This is what we call a blockbuster. This is what everyone is shooting for in their portfolio, is a blockbuster drug. And it's an antibody. But now we're entering kind of this newest, third modern form of medicine, which is what we call living medicines. This is using things like viruses, bacteria, cells, things that are quote unquote alive that we can now use to go in and impart changes in your body. Why would we do that? Well, both chemical medicines and protein medicines, we typically either give orally or we give intravenously, which means they're going to go throughout your entire body. But in some cases, we don't want a drug to go to your entire body. Like, for example, when you take chemo, boy, you feel like trash. Right? It's because it's also affecting healthy cells in your body. So sometimes we want the medicine to only go into a simple place in your body, or a single place, so that way you only experience the therapeutic effect in a single location. The other really cool thing we can do with things like viruses and cells is we can engineer, I know many of you here are like tech or tech adjacent, we can engineer in logic circuits. So we can add things like if, then, or, and all these types of kind of Boolean logic. We can engineer those circuits into viruses and cells and have them perform those same types of decisions within your body. Like if you experience this, release the drug. If you experience this, don't. So you can engineer in these types of circuits in order to get this really, really precise delivery of any particular medicine that you're interested in delivering. And you can package almost anything in a virus. And so a really common misconception is that all viruses are bad for you. All viruses make you sick. Couldn't be farther from the truth. The vast majority of viruses on the planet are very good at getting inside of you, but very few of them make you sick. I bet most of you can't name more than 20 viruses. And all the viruses you can name are viruses that make you sick, like measles, mumps, polio, smallpox, these types of things. We only know of them, because we study them, because they make us sick. But the vast majority of the viruses on the planet can actually kind of be considered our allies. They're tools that we can use that don't make us sick, but they're still very good at getting inside of us, that we can use to deliver all kinds of medicines. So all of this is talk. Much more fun to look at is an actual video of this in action. And so what I'm going to show you on this screen is a patient from a clinical trial, from a patient that has a rare form of inherited genetic blindness. This is a disease called Leber's congenital amaurosis. These patients are born basically medically blind. They cannot see at birth. And you're going to see two videos. The one on the left is going to be this patient pre-treatment attempting to navigate a maze. You can see that maze on the floor at very, very low light. So the reason that this looks very yellow is because it's taken at 1 luminal unit, or low light. All of us have much poorer visual acuity at low light than we do at high light. So it's not that this video was taken in 1985. It was just in very, very low light. That's why it looks yellow. So I'm actually going to start that video, and I'll kind of talk over this patient while they're going. So this patient's medically blind. They cannot see the arrows on the ground that they're being told to navigate, nor can they see the little obstacles that they're being told, like, you should step over. So they're feeling for them with their feet, just like you would if you were blind and you didn't have your walking stick. You would just kind of feel in front of you to see what was there so that you wouldn't manage to trip and fall. So I'm not actually going to show you this entire video because it took this poor patient 214 seconds to attempt to navigate this 8-foot by 8-foot maze. And all this patient needed, they were missing a single protein in the back of their eye. All they needed was a single viral infusion for that virus to express a single protein that that patient was missing in their eye. And this is that exact same patient. Again, this was a 10-year-old, just 1 year after treatment. They would have been able to do this within 7 days, though. So they have absolutely perfect vision. So we're able to completely cure blindness. This same young patient has now gone on to get their driver's license. They are walking, quite literally, they are walking amongst us, leading a completely normal life. So this feels crazy and revolutionary, like, oh my gosh, I hadn't heard about this. When is this coming for the rest of us and all of our indications? Soon. Where are we now? This is a 1-year-old slide. The next prospectus from Wells Fargo is expected to come out any day now. I was hoping it would come out before this talk, but it didn't. But this is the annual prospectus they put out every year of kind of the advancement of these gene therapy companies. They do this for every industry, but this is for gene therapy. So this is all of the logos of all of the companies that are working in gene therapy for various diseases. The outer rings are kind of the earliest stages of development, those phase 1, phase 2 trials. And as you move towards the center, towards the bullseye, that's when you're FDA approved and you can sell your drug for hopefully $21 billion a year and be a blockbuster. But as you can see, right, there is a wave of gene therapies coming for so even those few of you who didn't raise your hand earlier that you had ever heard of gene therapy before, I promise you, in your lifetime, no matter how old any of you are in this audience, in your lifetime, you are going to receive a viral gene therapy as medicine. So there's a particular virus, Dave mentioned it earlier, that I like to work on, this virus called AAV. And it's typically used, like we were mentioning before, to treat rare genetic disorders. Some of the disorders that we've been able to cure are the ones shown here on this slide. And again, we've typically only done rare single gene disorders. And in my lab at UCSF and now at the company, we wanted to ask a little bit bolder question. Typically, we've only used these to treat rare genetic disorders. Could we use these to treat other indication spaces, ones with many more patients where the need is much greater and the benefit to humanity would be much more? So we wanted to ask a rather audacious question. Rather than having a virus that might cause cancer, could you use a virus to cure cancer? Could you actually use a virus as a medicine that could be used to treat cancer?